first of all ask a question to Dr. Perry and follow up a little bit on what she had to say when she introduced herself. Dr. Perry, I'm curious, what drugs and medications are children and teens taking that are sending them to the ER? What are you seeing in the ER with regard to these kind of overdose situations?
Yeah. So I think it's important to sort of divide what we see up into two very different groups. So you have the young kids who are just sort of exploring things. They find something on the carpet, they pick it up, they pop it in their mouth. What has been different since marijuana has been made legal in Massachusetts is that they're more edibles and they look like food, right? They have the nerds rope, they have the gummies, they have things that really look like candy and food. And so when you have a kid who's say 3, 4, 5, 6, they see it, they try it. Usually they have fairly high strength, and so those kids come in pretty sick. And so we have probably in the past 2 years admitted something like 25 kids to the intensive care unit after inadvertently getting THC, presumably edibles. And for the most part, the parents it doesn't even register. They don't know that their kids got into it. They didn't expect that they would. So that's been a big issue.
Dr.
And
Perry,
then, go ahead.
go ahead. I'm sorry to interrupt. Go ahead.
No, it's going to go on to the teenagers.
Go ahead. You can do that.
So with the teenagers, particularly with the pandemic, we've been seeing a lot of mental health issues, isolation, anxiety, depression. And I think that a lot of kids are turning to more drugs. And so what we have seen, we definitely have seen some kids who come in acutely psychotic after taking too much THC. But what we have seen more of are kids who are taking pills, and frequently counterfeit pills. So I've had a couple girls who say they took Percocet, but when we do the tox screen, it's cocaine and fentanyl. So we actually are seeing a lot of fentanyl in Springfield right now.
Serious problem for sure.
Yeah.
Dr.